So our first speaker is Dr. Lee. He's an assistant professor of internal medicine at the Central Florida College of Medicine right here in Orlando. After his lecture today, he needs to run out. He's also a soccer coach for his kids. So if you have questions, we'll try to make them quick, but he'll be back later for that. Dr. Lee completed his medical education at the Medical College of Pennsylvania. He completed 2 fellowships in endocrinology and metabolism, as well as critical care medicine. He was a team endocrinologist for the Cleveland Indians baseball team. He's an international spokesperson. He wrote several books. I recently completed a book for children called Awesome Brain. He published a textbook of critical care chapter on the neuroendocrine immunology and role of neuroendocrine hormones in critically ill patients. He's a triathlete. He's one of my co-physicians on the panel. So I'd like to welcome Dr. Lee.
Well, I'd like to thank AMMG and for everyone coming out early on a Saturday morning. I live close by, so it was kind of tempting because I saw the golf course, like, you know, when you come right in, and it's like, wow, should I skip the lecture and play a round of golf? But anyway, I wanted to talk on heavy metals, and there's a lot of topics. I think this is a hot topic that we should be looking at in our practice, and that it's something that's underlooked. And I want to talk about 3 heavy metals, and if you're not familiar with it, I think today you'll be entertained. But endocrine disrupting agents, I gave a lecture at the Bellagio in November on environmental toxins, and now we have Bruce Jenners, who's now come out as a female, and I think it's really the endocrine disrupting agents that he's been exposed. But anyway, endocrine disrupting agents is a foreign chemical that affects the function of the endocrine system. And when we think of heavy metals, most people think, like, you know, you have to live in a polluted city with factories next by, but actually heavy metals are everywhere. It's even in Orlando, it's the Eskimos, like the Inuit Eskimos that live in the North Pole. This is what I tell my patients every day. They're exposed to environmental toxins, including BPA and DTT, but they also, basically all of them have basically heavy metal exposure. So heavy metals is in our water, it's in our air, it's in our meats, it's in our fish, and also in our organic vegetables. So your organic vegetables may be herbicide-free, pesticide-free, antibiotic-free, but it's not heavy metal-free. And every time an airplane flies, it's sprinkling heavy metals into the ecosystem. So it's the price of modernization. So there are 3 dangerous heavy metals, and if you listen to hard music, really loud music, which I did when I grew up, you're going to get exposed to heavy metals. All right, so we got 2 people getting this. I was deciding, should I leave it in? Should I take it out? All right. So anyway, the top 3 heavy metals, according to the Agency for Toxic Substances and Disease Registry, is arsenic, lead, and mercury. Now, I have a lot of doctors that does environmental medicine, and I ask them, like, what do you see? And it all depends. Like, I have friends who are in the Midwest, and they see tons of arsenic. What I see in Orlando or in Florida is a lot of lead and a lot of mercury. And sometimes more lead, sometimes more mercury, but those are the top 2 that I see in my practice. So there's the whole phenomenon with epigenetics, and it's really our environment that can alter our gene expression. It could be the foods that we eat, but it's also heavy metals. Heavy metals can affect basically the expression of our genes. It can alter basically the histone on our DNA, and in addition it can lead to alteration of the DNA methylation. So it can affect really at the molecular level. So there's approximately 250 different types of symptoms that heavy metals can cause. And the top two that I tell my patients is the reason why you should be screened for heavy metals is that it can lead to dementia or Alzheimer's. And the second thing is cancer. And the thing is that it can cause many other things, like it could affect your heart. I have some people with PVCs or AFib, and it comes back, they have tons of mercury. So you fix that, and guess what? It gets better. So mercury is considered the third most toxic element, and it's a little confusing with mercury, so I'll kind of go through the different types of mercury that's out there. But it can affect our cardiovascular, our hematologic, pulmonary, renal, immunologic, neurologic, endocrine, reproductive, and embryonic system. So it can really affect from head to toe. And I remember I had a patient that she had really bad AFib, and I said, you know what, let's get your hormones balanced, detox, get good nutrition. And eventually I said, let's do a heavy metal test. And she actually came back mercury, and she actually went to see her cardiologist. And the cardiologist goes, I don't believe in that. But apparently she really wanted to prove to this cardiologist that, listen, mercury can cause arrhythmias. So this cardiologist had several residents rotating with him, and she just said, well, why don't you have your residents just do a PubMed search or a medical literature search on mercury and arrhythmias? And then he goes, no, I have a program here, it's Harvard, blah, 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 and he couldn't find a thing. But the residents came back later and goes, yep, there's tons of articles. So it's out there. So there's different types of mercury. It's not important to memorize all this, but there's elemental mercury, and then there's inorganic mercury and organic mercury. The worst one is the organic mercury. It's the methylated mercury. That's the one that's most toxic. But in our environment, we basically have all three kind of circulating. So there's this cycle, of mercury cycle, that you have natural elemental mercury coming into our environment, but then we also, with modernization, we basically pollute. So you have basically inorganic mercury that can come out, and eventually it gets into the water system, and the bacteria in the water can convert the inorganic mercury to organic mercury. So actually organic can go to inorganic, and it gets into our food system. So you can see here that our fish are contaminated, and basically the ducks eat whatever, the small fish, and it gets into the whole ecosystem. And so even the Eskimos, and the Inuit Eskimos, they've been looking at them. There's mercury in their water, and their fish, and their seals, their polar bear, their whale meat that they eat. They don't shop around. They're hunters. So if they have it, guess what? We all have it. So elemental mercury, think of thermostats, thermometers, but also dental amalgams, and it can vaporize. Inorganic mercury, there's a lot that's listed there, but it's really cosmetics products. So that's why I don't use makeup. And then organic mercury basically is the one that's the most dangerous, and there's pesticides, and it's in fish, and it's in thimerosal, the vaccinations. So the half-life of mercury is, if you inhale it, it's 60 days, but it's estimated that the half-life of methyl mercury in the brain can last as long as 20 years. So remember, I guess it was biochemistry, that it takes like 5 half-lives before it gets out of your system, assuming you don't get reaccumulated. So it's going to be in your body for about 100 years. So this is a hot topic, amalgams. I'm not a dentist, but I've talked to a lot of my patients who are dentists, and they say amalgams, compared to composites, they last longer, they're easy to use. But there is mercury in your amalgams. And when I was diagnosed with, quote, heavy metals with mercury and lead, I immediately got my mercury amalgams removed. It's estimated that 67 million Americans exceed the mercury dose-associated exposure level of 0.3 micrograms per established by the FDA. So anyway, there are slides that show that there are fumes or elemental mercury coming out of these amalgams. So there's a lot of different diseases. There was a disease in 1961 in Japan in the fishing village, and they couldn't figure out why all these in this village, basically, they would have neurologic problems, ataxia, hearing problems, problems with vision, and eventually it was noted that the fish that they were eating had tons of mercury. This one is called, if you have acute mercury poisoning, this is a little different. It's called acrodonia, or pink disease. So just remember pink disease. You can have very bright pink hands, pink feet. It calls this polyneuritis. They have irritability and photophobia. I have practically never seen this, but anyway, it's just probably a good board question that, if you had to take your recertification, they may throw that in there. So the whole issue with heavy metals affecting the endocrine system, it's really, there's not much human data. That's the problem. I mean, there's more on like rats and animal data. It's one of those things that it's an evolution. And the thing is that who's going to volunteer to say, would you like to get some mercury and we just want to donate your body to science and see what happens. So, but here are some small studies that basically has shown that mercury and the other slides, lead and arsenic can affect the endocrine system. But increased mercury levels are associated with infertility. And they noticed that mercury in the hair of approximately 100 subfertile males had about 4.5 parts per million, was significantly higher than mercury levels found in hair collected from 42 fertile males. So you have to be careful of mercury. It can also affect the sperm. And there's evidence that shows that it can affect basically motility. So we have an epidemic, actually, of infertility. And I actually gave a little presentation about the extinction of men. And it's environmental toxins, and there's another slide I'll show to you that it's an autopsy study, and it's like, wow, it's in almost every endocrine organ. So what's interesting is that mercury can affect can inhibit the catecholamine degradation through inactivation of the 5-adenosyl methionine. So basically, you cannot break down catecholamines. So they're going to be hyper. So they may have tachycardia, or they may have issues with high blood pressure, or symptoms of, quote, feel. I mean, I sent one patient to the NIH because she had elevated catecholamines, and in retrospect, I didn't know back then about mercury, but I sent her to the NIH for like a 2-week evaluation, and she had elevated catecholamines, but they couldn't find it. But 15 years, 20 years later, it's like, maybe it was heavy metal associated with it. So anyway, mercury is found in the pituitary gland in autopsy studies, and they also noticed that there's an association with the number of amalgams that you have. I remember when I first went to visit my uncle in Korea. He's a dentist, and I'll never forget that I was sitting in that dental chair, and I just didn't like the tea that they offered in Korea, so instead of drinking the tea, I drank Coca-Cola while I was there, and I got he said 7 cavities, but fortunately he didn't put the amalgams, he actually put gold. So anyway, but the number of amalgams can actually has been associated with the mercury in the brain. So like the pituitary, the thyroid gland can be affected, and it can disrupt the thyroid, and it can disrupt it through the iodine binding sites, inhibiting the iodine basically binding to basically thyroglobulin. So there's some cases, there's really small, 3 cases of hypothyroidism induced by cosmetics containing mercury. So you got to be careful with beauty products. What's interesting is most people don't realize is that mercury can even affect your insulin. There's basically 3 sulfur sites on the insulin molecule, and mercury has affinity to bind right there, so it can affect even the insulin level. So this is a cool little study. It examined the amount of mercury, and this is a screening test, and they used the toenails to see the mercury levels. And it was a prospective study of almost 4,000 Americans aged 20 to 32. They were diabetic free. They didn't have diabetes. And they followed them until from 1987 to 2005. And they had basically 288 incidents of diabetes over this 18-year follow-up study. And it showed that the toenail mercury levels were positively associated with the incidence of diabetes. So, anyway, just to kind of wrap up with mercury, you could think as the pink disease, remember the pink hands and pink feet, but remember the Mad Hatter and Alice in Wonderland, you know that story. And back in the 1800s, when they made these hats, which was very popular back then, they used mercury, and those workers became, quote, mad as a hatter. So if you know, that's something to think of. But mercury is found in our fish, amalgams, vaccines. It's found in many different things, but those are like just if you want to just make a little list to remember things. But if you think of feel, think of basically mercury, and it can disrupt basically all the endocrine systems. So let's move on to the second most toxic element, which is lead. And lead is considered a non-essential element, and it can be exposed through ingestion, through drinking, or through eating. So I get a lot of patients, they go, well, how did I get lead? And that's why, well, you know, who knows? You know, the house that you lived a long time ago may have leaded pipes, and there was leaded gasolines in the 70s, and, you know, leaded paint. And it's very toxic. It actually can go to the kidneys, bones, heart, CNS, and endocrine system. So this is a cool little slide that shows that lead exposure was very low, like in the early 1900s, and peaked in like the 1970s. And then eventually we banned lead about 50 years later after every other country. And then the lead levels came down. But if you map violent crimes, it's basically right on top of this. So you can see that, you know, who knows? It's all these criminal acts is because the lead, you know, caused them to be crazy. So in 1970s, literally about 40, 50 years after the European countries, they decided, you know what, I think lead is bad. So they basically started banning leaded gasoline. And it didn't happen overnight. It was a phase. And you can see that basically the lead exposure came down. So lead poisoning, this is, you can see, in the city of Detroit, for children under 6, over time, the lead levels have been coming down. And children, like, this is common sense. They're sensitive to any toxic chemicals. So, I mean, you can cause issues with growth and deficiency. You can have issues with hearing, and it can cause bone problems and and kidney issues and high blood pressure. So it can cause a lot of different effects. But the thing that you really worry about is their IQ. Especially, they've noticed that the higher lead levels can cause a lower in IQ by 10 points. And actually, this was a study in New York. It was 276 children, and they noticed a 5 points decrease in the IQ if the lead levels exceed between 5 to 9.9 micrograms per deciliter. So the Center for this was a study that was out there, and because of this, they actually decided in 2012, the CDC said, you know what, there is no safe level of lead. And if you follow the lead story, the EPA and the FDA, they said, well, maybe a lead level of 40 is okay. And now that's 30, and then 20, and 10. And now the CDC says there's no safe level of lead. So that's what I tell my patients, is that it's a poison. It's going to cause many problems in your body, and you got to get it out. There is no safe level of these heavy metals. Unfortunately, the guidelines have not changed in terms of treatment for chelation. This is really, I'll talk about it at the end, but they should have dropped the guidelines for chelation, but they left it at like a lead level of 45, that it's okay to chelate. But I mean, they did not improve on the therapeutic guidelines. So this is a picture of inside of a stomach of a duck. You can just go to Google and image like duck and lead, and they basically open this stomach up, and you can see these little fishing pellets. Guess what? They're loaded with lead. So these animals are eating it. So I mean, it's we live in a toxic world, but lead comes from many different sources. It comes from old paints, which is very popular, and I'm sure a lot of countries outside the U.S. also, they probably still have lead paint. It's in our soil, it's in our dust, it's in our air. Ceramics. You got to see, what your patients are eating from. They may have these nice, dinner plates that basically is lead ceramic. They're getting their exposure through that. Imported foods in cans. Lead bullets. It's one of those things. So if you go hunting and you get some venison, I mean, now I ask, did you kill it with a bow and arrow, or did you kill it with a rifle? Car batteries, cosmetics. And some kind of other unique thing, artificial turf. I think it does, there's that question, does it save? There's a huge carbon footprint in making artificial turf. But anyway, as the turf ages and it weathers, it releases lead. Imported candies from Mexico have basically been associated with lead issues. Toys with leaded paint. It's like I mentioned, water. But there was a metallic charm from Reebok, and there was this child who died from accidentally swallowing this little cute charm from Reebok, and it was loaded with lead, and the kid died. So the thing is that that's a rare case. I mean, lead can kill. So Ayurvedic remedy, I don't do Ayurvedic medicine in my practice, but it's a traditional medical system in India that started a long time ago, and lead is regarded as an aphrodisiac. And there's a lot of published, not a lot, but there's published case reports that demonstrated that several of their formulations may contain large quantities of heavy metals. And there are 4 cases of lead poisoning for the therapy of diabetes through Ayurvedic medication. Now this is a big source. You know, it's called lead smelting, and the process is, you know, you dig in the mines, there's lead in the rocks, so you have to basically break up the rocks to get the lead, so it's a smelting process. So they've been looking at the populations, you know, that's around these lead smelting factories, and there's a lot of fertility studies, and I think it's it's coming up. But anyway, once lead is in your blood system, it actually likes to go to a particular organ, and that's your bones. So it also goes into your teeth, and it stays there. And it's one of those things that you can see in your practice. You'll see women that basically are not on HRT therapy, and over time they'll get Alzheimer's. But it's also when they go through the change of life, and they have a lot of lead, basically the bone starts demineralizing, and that lead gets released, get it into the brain system, it's neurotoxic, and it's the perfect storm. It's one of those things that can cause neuronal damage, and boom, you get Alzheimer's. So anyway, the half-life of lead in the blood is about 30 days, and the half-life of lead in bones is estimated between 5 to 19 years. And even the World Health Organization says there is no known level of lead exposure that's considered safe. So acute lead poisoning can cause basophilic stippling, and anyway, I hate hematology, so anyway, don't ask me exactly where the basophilic stippling is, but it can cause diffuse abdominal pain, it can cause anemia, neuropathy, ataxia, renal failure is very common with acute lead poisoning. It can cause convulsions, coma, and you can see this peripheral smear causing basophilic stippling. So what's interesting is lead can inhibit the enzymes of the porphyrin synthesis and lead to anemia. And one of the theories that it can cause neuropathy is that it can cause degradation to the axons and demyelination of the myelin sheath. And lead exposure can lead to basically kidney failure and high blood pressure. So here's a study for reproduction. You have 240 Croatian men that are relatively young. They have no occupational exposure to metals. Their mean lead level was about 5 micrograms per deciliter, and they showed an increase in immature sperm concentration. This other study on the side of it was a little bigger, had 2,000 patients, and they basically noticed a higher rate of stillbirth and birth defects with basically lead exposure. So here's some studies that around lead factories, and basically they noticed that women living near the smelters of lead, where they were basically extracting lead, versus people that lived far away, showed an increased frequency of spontaneous abortions. So the thing is that lead levels could basically, higher lead levels can affect pregnancy and fertility. What's interesting is that lead can also lower the 125 vitamin D. It basically blocks that conversion from going 25 vitamin D to the 125 D. So that's your active form of vitamin D. So anyway, lead exposed children with blood levels of 33 to 55 micrograms per deciliter had 125 vitamin D levels were reduced to levels compared to those observed in children with severe renal insufficiency. So as I mentioned, lead can affect your blood pressure, and I'm sure if I asked you, like, does anybody see high blood pressure? I'm sure everyone's going to raise their hand. And you got to also think, is it environmental toxins? I know it was a stress in life and nutritional deficiency, you're not detoxing well, but I've seen people that, you reduce their heavy metals, their blood pressure gets better. So anyway, one thing is that lead levels can decrease nitric oxide, and actually today, at this convention, Dr. Nathan Bryan's here, so if you have any nitric oxide question, you could ask him. He's the world expert on nitric oxide. But chronic low levels of exposure results in increased activity of generally the angiotensin system, so you're going to have an increase in renin, angiotensin 2, and aldosterone. And angiotensin 2 is one of the most powerful hormones that can cause high blood pressure. So lead can affect the pituitary gland. Lead can actually increase prolactin. It actually inhibits the dopamine control in the pituitary that leads to elevation of prolactin. And in theory, if you have high prolactin, you're going to lower testosterone. Lead also can suppress growth hormone and IGF-1 secretion, resulting in short stature. Children affected by lead levels have basically a decreased growth hormone response to any stimulations like with L-DOPA or with insulin. So here's a summary of how lead can affect the hormones. It can actually decrease the gonadotropins, GnRH, and also it can cause low LH, FSH. It can decrease the testosterone, increase sex hormone binding globulin, and decrease the estradiol. So this is a study that when I was reading, I actually fell off my chair. I was like, I was like probably most of you guys, I was procrastinating. I wasn't I knew I had this presentation, but I kept pulling it off. I go, I'll do it next week. I'll do it next week. And then I finally got the 1 week, final reminder by email saying, your slides are due in 1 week. And I said, okay, I'm going to start working on it. And I started reading a lot. And what was shocking was when I read this in autopsy studies that lead is found in the testicles and also in ovaries and also in the pituitary gland. It's a double whammy. It's going to cause low T. And I'm looking at studies like in the 1990, the average testosterone level for between 30 to 40, it's in 1995. This is not so long ago. About 20 years ago. It's about 700, 750 nanograms per deciliter. What I see in my practice, men in that age, their testosterone under 320 or less. So just 20 years, it's these environmental chemicals are being produced. And you have to also say, look, it could be heavy metals, so you have to test. It can affect the hypothalamic pituitary adrenal axis, and you're going to have effect on CRH and ACTH too. So lead is linked to the metabolic syndrome. And here's a study in rats that they gave lead to for 32 days. That's why you're not going to find a lot of human studies because you're not going to feed people lead. That's why there's that kind of disconnect. So you have to look at animal studies too. But anyway, they've noticed that when the rats got fed to lead, basically they had insulin resistance or metabolic syndrome. So another interesting thing is lead can affect the calcium metabolism. So we talked about how lead inhibits the activation of the vitamin D of the 125, but it's been shown that increments in PTH have been elevated PTH to lead exposure. So there's a really famous surgeon, Dr. Norman, who's the world leader in basically parathyroid removal. And I've known him, I've sent him a lot of patients, and he just recently gave a beautiful lecture to the Florida Endocrine meeting, and he was talking about how our calcium should never be over 10 if you're an adult. They briefly go up in the 10.5 range as you grow through puberty, but after that your level should be basically under 10. Do not wait for years until it gets 11, because that chronic exposure of high calcium can cause high blood pressure. It can cause, it even cause memory loss and many other issues. So it's very toxic. But the question I wanted to ask him was, do you think there's environmental toxins or like lead toxicity can affect the parathyroid glands? But I knew what he was going to say, so I didn't ask him that. But the thing is, I have a subset of patients in my practice that before I refer them to Dr. Norman for hyperparathyroid, I want to see what happens if I can lower their heavy metals to see if their PTH and calcium improves. So I'm just kind of doing a little study in my office there. So lead, hopefully you understand, is an endocrine disrupting agent, and it can occur at much lower levels, even down to 2.5 micrograms per deciliter. And it's really remains a significant public health issue. So you got to get the lead out. And I finally got my wife to do the heavy metal test, and now I know why she's crazy, because she's going to kill me. So don't tell her what I just said. Okay. All right. So the next one is the most toxic one. I'm saving the best for last. Is arsenic, and arsenic is actually highly toxic. It's inorganic form. Can combine with oxygen, chlorine, or sulfur. Arsenic is naturally present on high levels in the groundwater of certain countries, and it's contaminated water that from arsenic poses the greatest threat to public health. So arsenic is a natural component of the Earth's crust and widely distributed throughout the environment in the air, water, and land. It's odorless and tasteless. So the sources of arsenic are volcanoes. So I think in Hawaii they have an active volcano going on right now. So if you're going to Hawaii for vacation, you could look at the volcano far away. Don't go too close. But smoking, that's right here. That's everywhere. Mining, groundwaters, and it's in our soils. And farmers in the 1930s used arsenic as a pesticide. And arsenic doesn't go away. It's not like you get it and it disappears. It's in our system. It's in our ecosystem. Arsenic's a byproduct of smelting. So, the smelting process, you're trying to extrude like heavy metal, like lead and tin or cadmium from the rocks. It's actually what happens is arsenic comes out. So when they try to get gold, guess what? The byproduct is arsenic. So arsenic's used in a lot of different things. It's used in semiconductors. So, for computers, you say, well, we should never use arsenic, but arsenic is really tied in our modernization. So if you don't want to fly in an airplane or basically live in a modern world, you need this stuff anyway. So unfortunately, it's in insecticides, herbicides, algicides, glass manufacturing. It's in playgrounds, like those decks that's out there, the patios. That's basically sprayed with arsenic, and chemotherapy. Have anybody heard of the chemotherapy called Trisenox? Trisenox. It's arsenic. It's used for acute leukemia. And then you got to chelate after that, because it's going to affect everything else. So arsenic is a carcinogen, and the International Agency for Research on Cancer, National Toxicology Program, the US EPA, all recognize arsenic as a carcinogen, and it can affect your bladder, kidney, liver, lung, prostate, skin. So the top 2, 3, lung and prostate is up there. Arsenic has a half-life of about 10 hours. It can go under the methylation process in the liver, and 70% of arsenic is excreted mainly through the urine. And most tissues rapidly clear arsenic except for skin, bone, hair, and nails. So we had a mass poisoning of arsenic just recently in the 21st century, and there's a little country called Bangladesh. And the WHO estimated about 104 million people have been in Bangladesh have been affected by arsenic poisoning. That's half their population. So it started in the 1970s, and UNICEF wanted to help out to bring healthy water, so they started drilling all over in Bangladesh. And they didn't realize that there was a high levels of arsenic in the water tables there. So they were just basically poisoning, accelerating, their demise. So it can cause some severe peripheral neuropathy, GI symptoms, conjunctivitis, diabetes, renal failure, bone marrow failure, high blood pressure, cardiovascular disease, and skin disease. So you can see the classic, it looks like, looks ugly. Anyway, so chronic exposure to arsenic has led to diabetes, to type 2. Anyway, they've noticed that arsenic levels about 100 parts per billion has been associated with an increased risk of type 2 diabetes in Taiwan also, and also in Bangladesh. So the EPA has set a standard for drinking water at 10 parts per billion. So arsenic, this was, let's see, where's the study? It was, anyway, they had 67,000 residents living in arsenic endemic areas compared to non-endemic areas, and basically they noticed, this was in Taiwan, that they had a higher rate of type 2 diabetes, 7.5% compared to 3.5%. But here's another study. Instead of high levels of arsenic, this is low level of arsenic associated with diabetes. And this is a study about 1,700 patients, or diabetes-free patients aged 45 to 75, and were recruited from 1989 to 1991, followed to 1998, and 396 of them developed diabetes. And arsenic metabolism basically was associated with increased incidence of diabetes. Arsenic can affect the thyroid gland. So the thyroid process antibody, or TPO, not antibody, the thyroid process antibody is, like, thyroid peroxidase is the major enzyme involved in the thyroid hormone synthesis. And anyway, this arsenic trioxide inhibits the thyroid peroxidase activity in dose-dependent manner. And the minimal dose required to inhibit the thyroid peroxidase is between 0.1 to 1 parts per million. So remember, the EPA set the guideline for arsenic of 10 parts per billion to be safe. Here is a study that shows one part per million can affect the thyroid gland. So 219 men, here's another study in Michigan, in the US, fertility clinic. Arsenic was associated with an increase in TSH. Arsenic can also affect the pituitary gland and affect the IGF-1. So anyway, they've noticed that it can cause short stature. So arsenic trioxide, which is Trisenox, classically has been shown to affect the sperm and testosterone. So when you get this chemotherapy, guess what? You got to chelate right away. So what's interesting is this arsenic can cause significant decrease in the levels of mRNA involved in testicular testosterone synthesis. So arsenic is the #1 toxic element. It's highly toxic. It's also carcinogenic, and in addition, arsenic does not decompose, biodegrade, or move downward through soil. So it's in your soil, it's in your food, we get exposed. It's an endocrine disrupting agent. It affects basically your reproductive, thyroid, diabetes, and growth. So let me tell you that you got to be careful, medical legal, about saying heavy metal toxicity, because they're very particular about this. And I don't have like 25 years of experience in environmental medicine. So I learned a lot through, basically through reading and basically going to other lectures and all that. But the main topic here is it's the way you have to be very careful what you write down on your on your progress notes. And you can, I'll mention it, but you got to be very careful about saying like mercury toxicity, because there's a certain definition of lead toxicity and mercury toxicity, and that's through blood. And that's very rare, because unless you work in the ER and some kid was chewing some old paint and you check their lead level, yes, you can say it's lead toxicity, lead poisoning. But you have to understand that you get exposure, and then you get retention, and then over time you can have toxicity. So there's a thing about hair testing. It's a great screening tool, but you cannot make the diagnosis on a hair test or a toenail test. So it's really a blood work that really defines basically toxicity. So medically legal, like if you want a blood level, if you have a blood level lead of 45 micrograms per deciliter, that's toxic. So, but then if the person's sick and they're saying 20, you can just say toxic effect from lead. So it's pneumatics. But I just want you to also realize there's something called net retention or bioaccumulation. So we get exposed chronically, but the thing is that it can retain in our bodies, and hopefully through listening through my talk that you can understand is that these heavy metals like to go in endocrine organs, it can go in your bones, and it accumulates there. So the thing is that there's a whole big controversy of how do you diagnose this heavy metal issue. And American Academy of Pediatrics, they prefer blood level. But you know what? In basic environmental medicine, functional medicine, you got to do the pre and post challenge test because it's hidden in our body. So you have to do a pre-test, and you can collect your urine for 6 to 8 hours. And I tell my patients, ignore the instructions. It says, hold off supplements for a week. Hold off eating fish for a week. I just tell my patients, be tested in the real world, see what you have. And then the second day or next week, you have to do the challenge test where you need to take a chelating agent. You flush the first urine down the toilet. And then that morning you take basically DMSA, which it's about 20 milligrams per kilogram. I kind of dose about 22 milligrams per kilogram. You can go up to 30 milligrams per kilogram for DMSA. Once you swallow that, that's through compounding pharmacies. They can give you the DMSA. Then after you take this chelating agent, it grabs on your heavy metals and pulls it out, and you collect your urine for about 8 hours. And then here's my wife. I've been like, I was like, come on, do the test, and do the test. And finally, like I said, you got to take this pill and collect your urine. So she finally takes the pill. Then she calls me. She goes, I can't do the urine test. I go, why? She goes, my period just started. So anyway, you can't collect if you have a period. So anyway, she finally did it, and guess what? It's lead. So this is what you'll see. And the thing is, you have to mention that you have toxic effect of mercury. You can't say mercury toxicity. I mean, because if you get, quote, the medical boards that comes to your door and they're questioning your chelation practice or something like that, it has to be blood level. You're not going to be protected if you say you do this challenge test. You could say toxic effect from mercury, toxic effect from lead, but you cannot say the other way, like lead toxicity. So you do the pre and post challenge test, and the difference is really net retention. And the reason why you want to do it is, how can you prove that someone does have acute toxicity? That's why you have to do the pre-test and then do the challenge test and then see the difference. In the pre-test, I rarely see any elevation. I mean, 1 or 2, but I mean, generally I do not see elevation there. So actually, I'm almost done here. So how do you chelate? I think you gotta, this is way beyond my talk here. I think that you could use different agents, but EDTA can help remove lead. DMSA can lead lower lead, arsenic, and mercury. DMPS can lower arsenic and mercury. But if you want to learn more, you can go to the ACAM, the American College for Advancement in Medicine. This is what they like to do, is chelation, and get certified there. And then I just want to mention that there was this big controversy about chelation. Is chelation quackery, or does chelation really work? And in 2000, they had this, Congress said, okay, let's do a study. So they gave the $33 million to do this big trial to see if chelation was good for the heart. And basically, it was a 10-year study. It was a double-blind randomized study, and it was an integrative study. It was basically run by University of Miami Cardiology Department, but the chelation was done outside University of Miami at chelation centers around the country. So the bottom line, that chelation with vitamins basically reduced heart disease by 26%. Statistically significant. And it also basically, for diabetes, reduced it by 39%. So the thing is that it was safe and it worked. So this was actually just recently published in JAMA 2013. So now you got a big study that can say, yes, chelation does work. So if you want to learn more, you can go to this website here, and also the Agency for Toxic Substance and Disease Registry, and you'll learn a lot. So let me just finish up. The top 3 heavy metals: arsenic, lead, and mercury. It's in our environment, it's in our water, it's in our foods, it's in our soil, it's in our vegetables, including organic, meats, fish. And the bottom line is you got to get the heavy metals out. So I want to thank you. I have to actually I have a couple of minutes. I can answer some Q&A, answers in the back, but I will be back around 12 o'clock. I have to coach soccer for my kids, so it's a big soccer match. So thank you very much.
If you have any questions, you can just please proceed to the microphones. We have about 5 minutes for questions.
Yes, excuse me, good morning. I have a patient, Caucasian male, late 20s, no other problems, a fairly sudden onset of a unilateral pupil-sparing third nerve palsy. Everything else seemed okay. He has bruxism and a lot of dental amalgams with mercury. And the workup was not complete. It's a fairly recent patient, but I guess the question is, can you get an isolated lesion like that? The reading that I've done suggests multisystemic problems, just as you've said, but this is one little area.
I'm sure it's possible. I'm sure that it's multifactorial, like everything else. It could be nutritional deficiency. It's the perfect storm. So, you don't detox well. You can't get rid of environmental toxins, and it's whatever's the weakest link. Boom, so something happens. So it's hard to prove if that's the particular agent that the mercury and the amalgams can cause that particular lesion. But
you can get a localized lesion with these kinds of toxicities.
I'm sure in theory, yes, you can. It's just hard to prove because who's going to do the human clinical trials on it? So anyway, you're welcome.
Question. I had a patient about 50 years old who'd been eating a lot of tuna fish. I got a Genova heavy metal, screen, came back to the toxic level for mercury, and he did have dental amalgams. He went to his dentist. They wanted to charge him like $15,000 to take out his films. I said, why don't you just hold off fish? And levels went down to non-detectable. He felt very good, and then he started to add fish back to his diet, tested him again, went right back up. Took him off fish again, went down to non-detectable. Does this mean that his amalgams are safe, or he's just a poor metabolizer for mercury in fish? I don't know.
Mercury in fish is, it's really a big culprit. There's a lot of reports that you can see that has a lot of detrimental effect. But the thing is, he probably needs to be chelate, and you probably could do like an oral chelating agent to basically help lower his heavy metals on a chronic basis, because it's a chronic exposure. So, something simple like DMSA, oral agent, maybe 250 milligrams 3 times a week or something like that, and have minerals with it. But that's something that you can do to prevent, the toxic effect from mercury. So,
Thank you.
Good question. Yes?
Selenium forms a strong complex with both mercury, cadmium, and arsenic. And there are a lot of places in the world that have very low selenium and high heavy metal concentration. So what we've seen in looking at urine is that when you give someone selenium, you tend to push some of the heavy metals out, at least in urine. It's sort of probably chelating it. What do you think about the use of selenium? Because a lot of people are using selenium as a nutritional supplement.
I think there's other nutritional supplements like glutathione to help NAC, selenium. I think they're all great. Maybe 200 micrograms a day of selenium can help. But the stronger agents like the chelate agents are really the ones that, I think it's going to have more bang for his buck. But anyway, you can use that. That's perfectly fine, and follow it and see what happens. All right, last question, and then I got to run.
Yeah, what lab do you use that runs that test that you were showing? The challenge test.
Since it was asked, and I'm not basically promoting it, but it's Dr. Data, the urine, the pre and post test, and it's $60 per kit. So that price has not changed for like 15 years. Very reasonable.
Excellent, thank you.
You're welcome. Well, thank you, everyone.